So good afternoon. We're going to provide a vaccine update, including some more details on first responders and announce a new interactive dashboard around the public health data. But first I want to just give a quick update on the current COVID numbers. Yesterday, DPH reported 3,110 new COVID cases, 44,831 molecular tests were delivered and reported, and over 11 million tests so far in Massachusetts have been conducted. 2,291 patients are in the hospital being treated for COVID, and 416 of those are in the ICU. Obviously, due to the holidays, there are a few lags in reporting and fewer people getting tested. We expect that will catch up pretty quickly and give us a better picture about where our current trends stand in the next few days. Recently, we've seen an increase in cases and in hospitalizations, and we'll monitor that data to ensure that the Commonwealth's healthcare system has the capacity that it needs to take care of patients needing medical attention. Today, a new field hospital will open in Lowell at the UMass Lowell Recreation Center, which the Secretary and I had a chance to visit about 10 days ago. It has physical capacity for about 77 beds and is opening 14. This field hospital, in addition to the one at the DCU Center in Worcester, which has capacity at this point for about 72 patients, provide additional capacity to treat COVID and non-COVID patients here in Massachusetts. With respect to vaccines, obviously the good news is they're here and their providers are administering doses. We're also finalizing plans to move forward in the vaccination plan to begin administering doses to first responders. More on that in just a minute. As of the end of the day yesterday, there were 287,000 doses of COVID-19 vaccine that have been shipped to providers in Massachusetts, and 116,071 doses of administered vaccine reported to the MIIS system. It can take a couple of days sometimes for providers to report back to this system and DPH, so we expect that the actual number that's been administered is higher. 74 out of 76 hospitals in the Commonwealth have begun vaccinating their COVID-facing staff, and last week vaccinations began at long-term care facilities. This phase is organized through a federal partnership with the state, CVS, and Walgreens to administer doses to both residents and staff at long-term care facilities over the course of the next several weeks. Last week, all residents and staff at the Soldiers' Homes in Chelsea and Holyoke who wanted to receive the vaccine were administered first doses, and we're encouraged that the vast majority of eligible residents in both our hospitals and long-term care facilities, as well as staff, appear to be eager and willing to get the first dose of the vaccine. So far, we're seeing that many of the folks in COVID-facing roles know that it's a safe and effective way for them to protect themselves and their families in preventing COVID-19. Across the country, millions of doctors, nurses, and other healthcare workers are getting vaccinated because they know it's safe and it's a ticket back to what we might call regular routines and everything that comes with that. As more healthcare workers get the vaccine, more residents will be ready to do the same when they're eligible. With respect to first responders, obviously I think we all would agree that vaccine distribution can't happen fast enough, but the process also needs to be thoughtful and thorough. And while hospitals and long-term care facilities continue to administer doses, we've been finalizing plans for moving ahead with other groups. As a result, the Commonwealth will soon begin vaccinations for first responders. There are over 45,000 first responders across the Commonwealth, and this is a diverse group that includes fire, police, and EMTs who serve state, local, and regional entities. These men and women put their lives on the line regularly back before we had COVID-19. And for the last 10 months, they've kept on working the front lines, protecting and caring for residents across Massachusetts. Beginning on January 11th, first responders will begin receiving vaccine doses. Police officers, firefighters, EMTs, and all first responders work in risky situations every day, and this vaccine will protect them from COVID and the terrible illness that can come with it. The Command Center, the Executive Office of Public Safety and Security, and the Department of Public Health have been working with police and fire chiefs and local public health officials to develop these plans. first responders will have 3 options to get a vaccine. First, qualifying departments can request vaccines to be administered on site. There's a list of criteria for this option, and it's available in the first responder guidance that's posted at mass.gov/firstresponder-vaccine. Some criteria include vaccinating at least 200 first responders and having the necessary equipment to store the vaccines properly. Second, first responders can schedule an appointment at one of more than 60 sites. Today, the Command Center is launching a website identifying the available sites. Appointments will be available later this week. And third, over the next couple of weeks, the state will set up mass vaccination sites for first responders, and the Command Center is in the process of working out the details for these sites and can provide more information soon on locations, timing, and the rest. Secretary Sutters will have more to say on the specifics around first responder vaccinations later, but the Lieutenant Governor and I are excited to begin moving ahead in this particular vaccination effort. Finally, today the Department of Public Health is announcing a new interactive dashboard for all COVID-19 data. Massachusetts is proud of the fact that we have some of the most robust, accessible data in the country regarding the pandemic and our response. DPH has been generating daily and weekly reports for months to help experts and others better understand trends with respect to new cases and hospitalizations. DPH is now taking that data to a new level by building an interactive and more user-friendly dashboard to review it. Users will be able to search data based on specific criteria, such as hospitalizations or case numbers, and can review specific time periods. DPH will continue to build out this new platform. These enhancements will increase the accessibility of the information to make it easier for members of the public to study COVID-19 activity in Massachusetts and easier for others as well. The new dashboard will be posted at the same website as the old one, mass.gov/COVID, and it will continue to be posted at 5 p.m. every day. In many ways, the Commonwealth is trying, like our many others, to turn the page on COVID-19 as we head into a new year and begin to administer thousands of vaccines. Hope is clearly on the horizon as first doses are administered to some of our most vulnerable populations, frontline healthcare workers, and soon first responders. We're pleased that thousands of doctors and nurses and frontline healthcare workers, as well as long-term care facility residents, are eager to get the vaccine as it's made available. And we hope that as more doctors and nurses get vaccinated and share their experiences, they'll tell patients why it's safe and effective for them to do so as well. All this just translates into brighter days ahead, but we still have some tough days in front of us. We all have to continue to recognize and understand that it's important for us to do the things that stop the spread here in the Commonwealth every single day, and especially when we're around friends and family and neighbors and in what we've been calling those informal settings where people tend to let their guard down. It's critically important for people to continue to wear face coverings, to stay home unless you're going to work or to school, and not to gather with people informally if you don't live with them. If you feel sick, stay home and get tested. At some point, we will get back to something that looks a lot like normal in 2021, and we'll continue to work with the feds and others to get vaccines administered as quickly and as safely as possible as we can here in Massachusetts. But we also need everybody's help to keep cases and hospitalizations down until we get there. Please continue, as you have, to do your part, and we can and will get through this.